in South Africa, Cape Town, have experienced rape in their lifetime.
Proclaimed that enough is enough, and the community is protesting vehemently that action be taken.
And I am a woman. I am a pajama. I am a mother. And I agree. Enough is enough. Enough is enough.
Women in Health Together for Future is an international organization based in Cape Town, South Africa. WHTF collaborated with the University of Western Cape to arrange a symposium on critical concerns of gender-based violence on May 11, 2023. More than 100 people from 7 countries interacted through presentations, panel, and small groups. The participants belong to the WHTF board members, the university scholars and researchers, community-based organizations, and government personnel. Elizabeth Dardanel, the executive director of SVRI, was the keynote and spoke on advancing research for ending gender-based violence.
The panel discussion focuses on collaboration between universities and community-based organizations, especially the Fizantikar Group and Lionheart Ministry.
Today we want to hear from the diverse stakeholders of UWC programs. What do they think are the issues with regard to collaboration between UWC and their specific organization?
Institution can do it all. No one sort of state department can do it all, but together we can definitely do it. And we need to, in understanding what your partners can do, in understanding, I think a practical example is when I came away from working clinically, I was working at the coalface as a sexual offences examiner, and I came away from the clinical aspects into the more just more office-based and sitting in on meetings and fora, and that's when I first sat in on the Victim Empowerment Program Forum. And that's when I realized there's so much happening and there's so many facets of taking hands and working together for our victims. But my eyes opened when I understood what the partners are doing and what we can all contribute.
But I think it's so important to create that sphere in terms of the feedback and be responsible in terms of the expectations when you touch the lives of ordinary people, whichever partner you are, whether it is a leader in the community, whether it is from the university doing the research, or whether it is the clinicians that provide the research. And, you know, I am also thinking in terms of currently in health where I am involved with emergency, the ambulance services. So these are the individuals, and we have our public health response.
That really do lead to miscommunication and conflict between the students and the community organizations. And we really do want the students there because they enhance our projects. If we can have a system where students are coming in and they already have the basis of what's happening in the community, then they can just take on a project that's already there and just continue with it.
Second question is, what works to facilitate collaboration?
I think also, like I said, something simple like having a hub for the students. We know exactly where the students are and where we can go to and know where to find UWC. That was really helpful. And like I said, just having the students there, helping the volunteers with their projects.
I've had personal experience with the justice system that has failed me, where I lost a case that walked on for 2-3 years. At the end of the day, the DNA was lost, the files were missing. They kick out cases like that constantly. And even though we have a law and a policy that you can take up your case 20-30 years later, you don't want to put that same victim through that things. And there's certain things like another lady, I think it's one of the professors or the dean that mentioned about the subconscious, that plays a huge role.
There's a theme that was created during the lockdown. It's not leaving anyone behind. And I think as a higher education institution, the measures that need to be put in place, and especially with health, remains, and everybody can have that access.
It's a beautiful example of collaboration. The Tutuzela Care Centres came about. They are one-stop centres where we look after victims of gender-based violence. And I still say victims because when we see our patients there, they're usually still a victim. But the Tutuzela Care Centre sort of motto is together we help victims become survivors. And that's a journey, and that journey often doesn't start the moment the victim presents for a medical examination. It often starts much later, and we see that our patients need a lot of psychosocial support, ongoing support. So Tutuzela Care Centre is really a very centralized service where there is always a medical doctor or a forensic nurse examiner on duty in order to do the forensic examination for a patient who presents after sexual violence.
So there's a lot of things involved where the church needs to take its stand. They need the training available, and especially with students. So students usually get plugged into faith-based churches around the residences, and that's where I started reaching out to them because they haven't felt comfortable by going to counselors on the universities.
The families and community groups expressed critical concerns.
But when it comes to real issues in our communities, we lose the essence of family. It's only through families that we really, our social fiber in our communities is gone. And it's gone because we've allowed it to be gone. But how do we bring it back into the GBV space? Is to make sure collaboratively we address it.
Sometimes just ordinary people like me, myself, don't have the knowledge to go to. Or even to work with a broken woman. The passion is there, but the connection is not there. The community, sometimes, you can just relate to somebody, connect with somebody. Well, like if you come through rape, whatever thing is, the best person is like somebody that went through the same thing what that person went through. But
I just want to say that, first of all, I think we're all here because we really do want to get to zero. And I hope that hope grows up in a world with zero prevalence of violence against women and children. I think we have a lot of work to do.